Yo guys, Grand Training Systems, welcome back. Today we got a different theme. We're going to start working a bit on an injury and what causes it, so a specific one. And then in the second video we're going to talk about how to fix it. So today's request was, Bill, I got your back here, on jumper's knee or patellar tendonitis, or basically just knee pathology, knee pain. So we're going to talk about a bit what it is, and then in the second video we're going to fix it. I think the first, we've got a few interesting points. I think one, which one should I start with, is we're talking about the certain muscle right here. It's called the VMO. It's the muscle that is right on the inside of your knee. We sometimes call it the teardrop muscle. One of the interesting things about this particular muscle is it only works during the last 15 to 0 degrees of terminal knee extension. So this is when I'm closing or locking or straightening my leg right here. So a lot of times when our exercises we are doing, we're not really locking our knees, so we sometimes get an underdeveloped muscle here. This is why a lot of times you see a lot of athletes doing certain exercises where they're doing a straight leg raise, they're doing a one-leg extension. You got me on the camera there, sorry, I'm moving around here a bit. So I think it's important that we understand that this bone right here, that moves around, the patella, what I'm going to get into in a second, is controlled by these 4 muscles. And when one muscle starts to get a bit small, he doesn't do his job and we start getting the knee moving laterally. You're not going to see this with your eye, but this is what's going on. And we need to remember that the cartilage that allows bones to move is about 7 times slipperier than ice on ice. So we've got a little road under this bone. When it's following in that bone, or in that road if you will, that's the cartilage it moves up and down in. When this muscle becomes weak, it starts skipping out of that cartilage and it starts to hurt a bit because bone on bone, well, bone is the most sensitive tissue in the body. So you can imagine if you go bone on bone, it's going to hurt quite a bit. Second thing I want to talk about is this thing right here and how it moves. It's called our patella. It's a sesamoid bone. We have 3 in our body, 2 in the bottom of our toe and 1 here. And it's quite important because if we didn't have this bone, you can compare it to right here. This would be our quad, our knee, and then our lower leg. And then the muscle would basically be similar to this rubber band, moving like this, which I don't even want to do with my rubber band because it's going to cut. But instead, we have something that makes it a bit round. So you can imagine now, if I were to put something like this here, here's the quadricep and it attaches to the knee. Now we've got something that changes the angle of the leg. The problem is, as we spoke about before, this bone needs to be able to move when it wants to, up and down, or left and right. But if this tissue starts getting matted down and one of the muscles becomes a bit weak, it doesn't really want to move so well. So that starts causing also some problems. And then the last thing, which is the most important, is we have something called the screw home mechanism. And right at that last 0 degrees of extension, you might notice that your foot turns out just a little bit because this is the joint screwing home. So you might notice it, you might not. One of the tests we like to do is if the athlete can sit, or anyone can sit, and if they can tighten their leg and get their heel in the air. And you will notice that your leg usually turns out just a little bit, just like that. That's the screw home mechanism. So right away, we're really speaking a lot about this final degrees of extension, if you will, that the patella needs to move. This muscle needs to be tight, and we need this screw home mechanism. So a lot of times this patellar tendonitis, this jumper's knee, this patellar pathology, this knee pain is really coming from this tissue just being matted down, held down, stuck together. We used to think it was from a weakness in this muscle, and that's why you see a lot of the exercises I was talking about before, or the one-leg extensions where we're always working on this terminal knee extension. Sometimes that's the case, as we spoke about before, because a lot of exercises don't really focus on locking that leg out, but more and more and more we are realizing it comes more from the tissues not really working together, the fascial system being a bit locked down and basically glued together. And when we start doing the mobility, which we will see in the next video, and some stretching and regain that range of motion, everything starts moving better and it allows the pain to go away. A lot of times we talk about taking anti-inflammatory medications. For me, and what I push my guys to, is we want to not turn off the sensor, meaning unplug the light, to where our body's telling us something is painful and destroy our stomach and intestine, at the same time. So I'm more about finding the root cause of the problem, fixing that, and staying away from the drugs. So in the next video, if you do have patellofemoral syndrome, jumper's knee, whatever you want to call it, patellar tendonitis, we go into how to fix it. So hope that made sense, and I see you guys in the next video.